You're out of breath, but you only walked up a single flight of stairs. Your heart is pounding like you just ran a marathon. Maybe it's nothing. Maybe you're just out of shape. Or maybe your lungs and heart are struggling with something far more dangerous. Pulmonary hypertension. A silent, progressive killer that's often misdiagnosed until it's too late. It's not just high blood pressure. It's a ticking time bomb in your lungs that forces your heart to work overtime. And if it goes unchecked, the consequences are terrifying. How do you know if you have it? And more importantly, can you stop it before it's too late? Let's break it down. What is pulmonary hypertension? Most people hear hypertension and think of regular high blood pressure. But pulmonary hypertension? That's a whole different beast. Instead of affecting your whole body, it targets the blood vessels in your lungs, making them narrow, stiff, and harder to push blood through. Your heart, especially the right side, has to work extra hard to pump blood into your lungs. Over time, it gets exhausted, and then it starts to fail. And here's the scariest part. By the time most people realize something's wrong, the damage is already done. Symptoms you can't ignore. So, how do you know if pulmonary hypertension is creeping up on you? The symptoms are subtle at first, but they get worse fast. Shortness of breath, even with light activity. Fatigue that feels like you've run out of batteries. Swelling in your legs and ankles. Chest pain or pressure, especially during movement. A racing heart, dizziness, or even fainting. And if left untreated, it can lead to heart failure, blood clots, and a drastically shorter lifespan. Who's at risk? Pulmonary hypertension doesn't just happen randomly. It's often triggered by underlying conditions like smoking or long-term exposure to air pollution, heart disease or uncontrolled high blood pressure, chronic lung conditions like COPD or sleep apnea, certain medications, and even genetics. If you check off more than one of these risk factors, your heart and lungs could be fighting a battle you don't even know about. Can it be treated? The bad news? There's no outright cure. The good news? It can be managed if you catch it early. Doctors use oxygen therapy, blood thinners, and special medications to open up the blood vessels in your lungs. Some cases even require lung or heart transplants. But the real key? Spotting it before the damage is irreversible. So, if your heart's been racing, your breath's been short, and you feel more exhausted than usual, don't ignore it. Pulmonary hypertension doesn't wait, so neither should you.